And you say, well, what about them buying insurance on their own? Have you ever tried that? Let me tell you a little story. Years ago, when I stopped working as an audiologist and I started working as a temporary worker so I could also do acting, I had no insurance for years until I started working for Conseco, and then I had insurance again. Those years without insurance were not pretty. Things went by the wayside quite a bit. Because if you don't have money, you don't go to the doctor unless you absolutely are in trouble. I tried to get individual insurance, an individual policy. I knew it would be very costly, but my folks, who were alive at the time, said, you know what, whatever the cost is, let us know, we'll help you with the cost. I'm going, okay, well, I'll find out. So, applied for insurance, health insurance, single policy, just me, no group plan. And that's another thing these people forget about. But anyway, just buying it as me, single person, no dependents, whatever. And I was denied coverage. It wasn't a question of being able to afford it because they denied me on the basis of my diagnosis of chronic fatigue syndrome. And I said, fair enough, that is a pre-existing condition and I wouldn't expect you to cover that kind of stuff. It would have been nice, but I wouldn't expect it. But what if I'm just driving to work or whatever, because I worked all throughout. What if I'm going to work and someone T-bones my car? Not even my fault. They run a red light and T-bone my car. What about that? No. No, we just can't insure you. Now, that's pretty funny when you consider that a lot of doctors will honestly say they don't believe that chronic fatigue syndrome exists, but this insurance company denied me on the basis of that diagnosis. So I went back to my folks and I said, I so appreciate your willingness to help me out with the insurance, but it's a moot point because they won't insure me. They will not sell me a policy. They wouldn't send me a policy with a high deductible. They wouldn't sell me a policy that was totally restricted to just accidental or whatever. No, no. No, no. No insurance at all. So I thank my parents for their offer, but I was so shocked. To this day, I'm shocked because, as I say, even though the CDC has a huge website about chronic fatigue syndrome, and, you know, if it were really not a problem, I don't think they'd have a website this large about it. And if you want to go, cdc.gov, chronic fatigue syndrome, take a look at all the crap they've got up there. For an imaginary illness, there's a lot of information about it. Unfortunately, not how to diagnose it and not how to treat it, but okay. Okay, so when I started back in working full-time for a company that had a group plan, of course, I was insured. Pre-existing conditions didn't matter after a certain period of time. So again, I was back in the system. And I've been insured ever since, really. It's a PPO. So, and all my doctors are in that plan, and frankly, I don't go to a doctor that isn't in the plan, but so many are. It's not a limitation. So, you know, during that 3 years where I didn't have insurance, a public option could have been very helpful. But there was none. I just didn't have insurance. So you put things off till they're way out of control. You put things off, you put things off, you put things off. And that's really not what you should do with your health. Take care now.